Now, when we go through the list of clinical features in this particular patient, we'd look for the factors, and you would notice when I mention the different clinical features that it's basically an overlapping features that is seen in a patient. When you compare a single patient of CSF with another patient of CSF, you would see that not all the features are always present in the patient. It's always a diverting picture. It's always a diverse variety of clinical pictures. The comorbids would be even different for different individuals. For instance, the reason behind this particular criteria, or the reason behind this particular fact, is that the history is different in the different individuals. The perpetuating factors are different. The predisposing factors are different. The comorbid conditions are different. Not all patients would undergo childhood trauma. Not all patients would undergo recurrent infections. So you would have to keep this in your mind that the clinical picture would vary. And there is a long list of symptoms apart from the symptoms that I would be mentioning over here. And it is basically a vast variety of clinical condition, and we'd be seeing a vast variety of signs and symptoms that the patient is suffering from. So it's just a comprehensive list, and just to simplify the features of chronic fatigue syndrome in the individuals. So the key features would be intense fatigue. Now, how do you differentiate a normal fatigue from a fatigue individual who is suffering from chronic fatigue syndrome? So as the word is indicating, we are dealing with fatigue syndrome rather than individual fatigue. The patient is also going to have some other factors as well. It is going to be a range of signs and symptoms. Comorbids are going to be present. Labs are going to show that the ESRs are raised. He's having fever, she's having fever. So all of these correlated factors are going to basically enhance the picture, and you're going to diagnose that the fatigue doesn't even go away with sleep. So even the patient is going to complain of a chronic fatigue that he's suffering from, even when he gets up, having complete sleep of almost 6 to 8 hours, he would be still suffering from this fatigue syndrome, and he would be having headaches, and he would be having myalgias. And this would be basically how you're going to differentiate a normal fatigue from a fatigue syndrome that we are dealing in with. So history is again very important. The chronicity of histories and the associated symptoms are going to be related over here. This fatigue is sometimes associated with pain. Now, pain can be anywhere in the body. It can be the myalgias that are relating to specifically the limbs, and it can even involve headaches. A lot of patients would give you a history of retroorbital pain. Patients might be also giving you a history of migraine and headaches, orthostatic intolerance. That is basically on standing in upright position, the patient is suffering from severe headache on either side of the head. So this is all basically, even the pain has different kind of a picture in the patient. Multiple patients are going to suffer from different kinds of pain. Even the severity of the pain is going to differ from patient to patient. The intensity, the location, all of these have to be noted down in detail when you're writing down the history in the patient. Then we have cognitive dysfunction. Now, this cognitive dysfunction is also regarded as the brain fog. So the mental fog, the patient that we had, Gracie, we were discussing Gracie, a 38-year-old female who had been suffering from CFS, and she was also suffering from mental confusion. So this mental confusion, this state of confusion, this brain fog, and inability to even perform up to the mark at the workplace, all of these have to be noted down in the history, and they're basically pointing out towards the mental confusion and the brain fog that the patient is suffering from. So as you can even correlate to the fact the patient is having physical condition as well as the patient is suffering from psychological conditions. So these are the two major aspects of this particular disease that we are discussing right now. Unrefreshing sleep. So the patient would be suffering from sleep disturbances. Usually they would get up early in the morning, almost between 1 a.m. to 4 a.m. going to bed even late at night. They would rise up early in the morning, and after that they would be unable to go back to sleep. So this kind of a disturbed sleep they would be having, and again, if even they would go to sleep, the sleep wouldn't be refreshing for them. So these sleep disturbances are the particular factors that we're going to focus on. Headaches is again one of the phenomena seen. It can be even related to the sleep disturbances. So all of the signs and symptoms are basically interrelated and interconnected in cases of CFS over here. Now, again, we can have the patients who are suffering from sore throat. So the comorbid conditions, the comorbid infectious states again make the patient immune system is decreased, and they cause an imbalance in the patient's immune system. A sore throat is a common phenomena. Even a lot of patients would be suffering from a flu-like syndrome, and they would be constantly having the headaches and a sore throat, a bit of a cough, and all of these symptoms are seen in different scenarios and in different severities in the patients. Then tenderness in the lymph nodes is again due to the multiple infections or the recurrent infections that are noted down in these particular patients. So these patients, when you would be palpating the submandibular or you would be palpating the cervical lymph nodes, they would be having the tenderness that is on touch. They're going to complain of pain. Now, the muscular aches was one of the key factors. So myalgias, muscular aches, fatigue, these were the key features. So we cannot really forget these key features, and sometimes they are the only features that are present in the patient, and sometimes it's not an associated picture. But of course, the comorbids are present, the predisposing factors and the perpetuating factors are also present in the history. Then joint aches is one of the symptoms that would be also seen in the individuals. It can be the joints, the knee joint, the ankle joint. They are the joints that are mostly affected. Feverishness, so flu-like syndrome basically encompassed all of these factors: sore throat, a bit of cough, feverness, and along with this fever, when you test for the ESRs and the infections, that is even going to relate to an increase in the TLC count, and the infectious states, the fever is going to be present in the individual. Now we have difficulty in sleeping. We already focused on the fact that the patient is having a disturbed sleep. All in all, psychiatric problems are present. So this is an important comorbid condition. As I even mentioned, cognitive behavioral therapies are usually coupled up along with the graded exercising techniques. And according to a research that was carried out on this particular fatigue syndrome, that was called a PACE research, this PACE study basically revealed the factor that behavioral therapies, counseling sessions are even going to improve the condition of CFS in the patient. So the fatigue basically goes away when the patient is psychiatrically counseled, or even the underlying psychiatric conditions. For instance, if the patient is suffering from depression, anxiety, panic attacks, if they're treated, then the patient shows a lot of improvement in the fatigue syndrome as well. Now, allergies, or the if the patient is suffering from some sort of allergies, for instance, it can be dust allergies, pollen allergies. So this would be a usual history that the patient would be having. And then we have abdominal cramps. So along with the headaches, the patient is going to have the GI symptoms. In the list of the GI symptoms, we have abdominal cramps, we have diarrhea, we have nausea, vomiting, and they are sometimes related to the migrainous attacks or to the severe headaches the patient is suffering from, and sometimes they're in isolated factors or the isolated set of symptoms seen in the patient. So all in all, when you look at this complete clinical picture in the patient, you would be focusing on the fact that the patient is suffering from a series of signs and symptoms, And you have to look for in these particular signs and symptoms, and the clinical picture usually varies from one patient to the other patient.